Welcome to the office. Hi, Joyce.
Hello.
Welcome.
Hi.
Welcome
Thank
to
you.
the office.
Yes.
So, we have some things to talk about.
Yes.
Now, this is a different consultation because we're standing.
Yes.
And we're standing because it's more comfortable for you.
Yes.
Because you have pain.
Yes, I do.
All
I
right.
didn't take my meds today because
What meds are you taking right now?
a bunch of meds that I can't pronounce.
Okay, no problem. And today you
Second.
decided not to take it.
Yes, I decided not to take it today because it's just better.
Okay. You have anxiety too.
Yes, I do because I'm in pain too. I have sciatica too. So
Okay.
and I've been loopy lately, irritable. You can ask my sister.
Come over here. Come closer.
I had depression. It just affects a lot of things.
Children?
Yeah, I have 2 kids, 7 and 5,
Nice.
and
Boy, girl?
a boy and girl. Girl first,
Okay.
girl 7. And you're my 8th chiropractor that I've seen.
Well, I'm the 8th chiropractor you are seeing. This is our first encounter.
Yes.
Okay, and you've been to 7 previous ones.
Yes.
You've been obviously to other specialists.
Yes.
When did all this start?
So I've started seeing a chiropractor after I gave birth to my son.
Okay, you keep talking because I think I need to sit. I think I'm going to be the one getting questioned here. All right. Is this okay for you?
Yes, it is okay for me.
Okay. Talk to me.
And so I've had to carry a lot of heavy things, since joining the military. I was active duty for about 6 years. I went to the active guard side.
You were in the Air Force.
Yes,
Cool.
in the Air Force, and
Yeah.
I just re-enlisted another 6 years actually.
Okay, good.
And I want to stay in the long haul, and it's really important to me and to be in tip-top shape. That way I can get back to doing my physical fitness. So late September, after me and my husband did a side-by-side trek through the woods, it was really fun. The day after our 5-hour side-by-side trek, I woke up and I felt like my body was fighting something. I think it's all the acid from my muscles because my muscles are so tense.
Okay.
And I was just doing dishes, and then I sneezed really hard. And my mistake was I closed my mouth. I didn't open my mouth, and then after sneezing, I couldn't stand up. I struggled to go to the bathroom because I had to go to the bathroom. Standing up, I had to call my mom. I can't stand up. I don't know what's going on. I went to the ER. They told me to go to the orthopedic clinic. From the parking lot to the orthopedic clinic, I was struggling to get out of my car. I had my 7-year-old get a wheelchair because we can see the wheelchair up by the door. So, there wasn't a lot of cars in the parking lot, and so she had to walk to the entrance, get the wheelchair, and just so I can hoist myself on the wheelchair because I was in so much pain. Come to find out, after that they told me to go get MRI. From the MRI, they found out that I had some herniated discs and a couple of bulging discs.
But where are you at right now then? Okay, so you were told this. You've been going for treatment. You went to therapy.
Yes.
You went to several doctors. Did anyone tell you surgery?
Surgery is the last resort.
Okay.
One of my 6th chiropractor, because I just was describing to him how much pain I was in, and I think he said, I can refer you to a rheumatologist or to a surgeon to see what they think. And then,
That was the comment?
Yes, and I kind of fired him, so I went to a different one.
Okay, now let me ask you this. Out of all the ones you saw, we don't have to get into each one.
Yeah.
What treatment, what gave you relief?
So, I had a cane. After my episode in September, and I went to, I couldn't walk. I had a cane. So, the chiropractor that gave me the most result was he made an adjustment.
Hold on, you joking?
He did an adjustment, and then literally walking in the office, I couldn't walk. So the most result I've gotten was I went in his office, I couldn't walk, I had a cane. He did a couple of adjustments. After that, I could walk. So that was the best adjustment where you really can see there's a significant difference.
And how long did that last you?
Um.
And did you continue that treatment?
So I continued that treatment for about 4 to 6 weeks, and after that, I was fine. Come November, I was able to throw my daughter a party. I went to a club. December, celebrated Christmas. I mean, I wasn't 100%, but at least I could walk.
What does that mean? You were 20%, 50%?
That's a good question. Probably I was 70% back. No, probably because I also have a high pain tolerance. I
And where
just
are you
brush it
now?
off. Probably more like 45, 48, 45%.
So what brought you back from 70?
Early February, I was just stretching. I was at work on base. I was just stretching, and I thought I just overstretched because I felt like I had overstretched and I had pain over here, and so I gave me a couple of weeks before going back to my every other day chiropractic treatments. So I rested, and then it didn't get any better. It got worse, inflamed. My muscles are tight.
Okay.
And it's harder for me to be active and do
And
regular things
right
without
now
muscle
it's
spasms.
it's the low back
Yeah,
pain.
low
and-
back and sore over here.
Okay, turn around so I can see. So here and
Yes,
here.
Yes, and then sciatica shooting down on my.
I want you to look at your foundation first, okay? So 24 bones in the spine. This is your 24-story building. This is the foundation of your building. And before even talking about L5 and L4 and all that, we need to see, do we have a level base and foundation?
Nope.
And we can see we clearly don't have a level base and foundation, right?
Yes.
Let's look at the numbers and see what they're actually telling us. When we look at the numbers, certain things are making sense, and there's something hiding in there that I need to explain to you. You have a rotated sacrum on the right side. You have a rotated pelvis on the left side. You have a measured difference of 7 millimeters here on the right leg. So your right leg is 7 short. As long as we can keep it under 7, things will hold. If we cannot keep it under 7, a heel lift may be indicated. But there's a catch to what I'm about to say now. In your case, a heel lift is not indicated. And the reason why a heel lift in the work that we do here, we have a curvature, or I don't want to say a scoliosis, but we have a lateral curvature away from the short leg. That is a contraindication to a heel lift. So a heel lift is not the answer here. Okay, an orthotic, that's not the answer. Let's go back to the numbers and get some answers now. This is what I see, man. This pelvis, whatever happened here, came after. You have a rotated sacrum, but what I see is something down low here. And I see a bend down in her sacrum, down in S4, S3, S4, down in her tailbone. Do you see what I'm showing you here? You see this curve here?
Right.
Do you see that?
Is it not supposed to be there?
It's supposed to be straight. So we have a bend in the tailbone, and that bend in the tailbone started your imbalance. Because here's how I'm seeing this. You have a 7 millimeter measured deficiency or measured difference. If I adjust your left pelvis, I make it worse. So if you were getting your pelvis adjusted both sides, that was never your answer. Okay?
Yes.
I want you to see what she's doing. This is her relief position, guys. No, it's okay. You're not comfortable. We need to get some answers. So what I see here already, Joyce, is the sacrum, okay? I'm not touching your pelvis. That's not your answer. Number one. Now, let's go back to this. So we have, this is the catch. You played hard too. And I'm going to tell you when this all started because you're not telling me. The right side is down, the left side is curved. You have opposite. So one side goes down, the curve goes the opposite the side of the curve. That's your disconnect in your foundation. Okay, so let's look at your posture. And your posture is not bad here. This is your L5. It lines up with your C7 and C2 for the most part. So you've held your posture. Maybe that's military training. Okay? But let's get to the answer and looking at your discs now. This is a weight-bearing x-ray. When we're looking at weight-bearing structures, they should be imaged weight-bearing. And I'm going to give you what I see here. This is a good 20-year-old injury. You're 30 right now?
Yes.
This is when you were 8 or 10 years old is when this low back injury happened. Okay? So you guys can think about that. And what I see here is this. I talk about the tailbone a lot. People think I'm crazy by saying you have a bent tailbone. You can see that, right? It's not a smooth arc. So you do have some tailbone injury here, some bend. You have a sacrum, the bend in the sacrum here. We have some old tailbone injuries. We have a misaligned pelvis. We're not touching the pelvis because the pelvis will make your hip worse. I want you to see the shape of this disc here. And the shape of your L5 disc tells me that's a good 20-year-old injury. And when I see this piece right here, there's a little bit of calcification on the edges. The body's trying to stabilize that area. That wasn't, you had an old injury that was never stabilized. And you've been getting certain things done, but not getting to the actual cause of the problem. I'm sorry I have to say that, but that's what it is. L4 you can see is tilted, yes? Yes?
Yes.
L4 is also like a 15-year-old injury. This is good 20 years. This is about 15. And then what happens? Then it gets okay, but I want you to see this. This tilted wore out. This is tilting, starting to wear out. Tilting, 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 tilting. This whole thing is compensating from your tailbone, your sacrum. Now let me show you on this x-ray and we're going to get started. And I do see you played, I mean, you did hard work. You did some good hard work. The spine curves this way, then it curves this way. And then it curves this way, and then it curves this way. It's just waving all the way up. And I can't find a level disc on your lateral film. So what that tells me, all of this stuff up here is compensated. We don't need to mess with that. If I find something in your upper cervical, I'll deal with that, okay? But this is a sacrum issue number 1. Once we can get the sacrum resolved, then we need to get to 5. This is not a herniated disc case that I have to go in there or you have to go in and get something cut out. What this actually is you got to get your sacrum L5 moving. It's not moving, that's why it's wearing out. And because it's wearing out, if it continues, they're going to tell you to fuse this. That's where they were going with it. Okay, I'm just letting you know. Because look, Mom, you see this? You see what I'm talking about? You've heard me talk enough on my videos.
Yes.
But you see how thin this disc is. That's not a 30-year-old's disc. That's a 65, 70-year-old's disc. So we got to get movement in this now. Can we get started?
Yes, please.
Have a seat over here. Let's get started. Take your time. Can you walk one more time for me, actually?
Yes.
All right, I want you to walk towards the corner of the... So you're in Anchorage now?
Yes.
Yeah.
Anchorage Bowl.
I actually have a patient from Alaska. She comes down a couple times a year to get adjusted.
Oh, yeah?
Yeah. I have a couple videos with her. Come over here, please. She's got a lot of swelling right there.
Yeah.
This is a puffy sacrum. And you can see this side is lower, this side is higher. When she walks side to side like this. She doesn't walk through her dimples. Go ahead and walk towards the door, please. She got the Anchorage wiggle. Keep walking one more time.
Oh, I'm tired. Just
Okay, come on, have a seat. Let's get started. Starting at the base of the neck. All right. I'm getting 10 points, C1 up top, occiput. She has cord pressure going all the way down. So what I'm getting with you, Joyce, you got 11, 12 points, C1. The needle is sticking the whole way down, all the way down to the sacrum. And as soon as we get there, it switches size. This is classic cord pressure and sacrum. Okay, so we need to, this is what I'm seeing. What's going on here is she's got old tailbone injury, and this L5 disc is a good 20-year-old injury. So she was 10 when that happened. This was an old injury that exacerbated over the years. And I can see a lot of puffiness in this tailbone, okay? That's number 1. Today she has cord pressure in the upper cervical going all the way down her left side, and this whole sacrum is puffy. Now we need to figure out where we're gonna start. If you come back slowly towards me, ma'am, this is number 5. I know. Sorry, that's 5.
Tender.
Yes, S1.
Tender.
S2.
Tender.
More tender.
Oh.
Yes. S3.
Oh my God.
Yes. S4. Okay, it's between. You feel this little nub here? This is S3. This is S4. It's S3 on S4. One more. S5. Not too bad?
Not too bad.
S4. Tender,
Yes.
but starting at S3.
Yep.
All this is swelling. 5 is tender. 4 is tender.
Yes.
3 is tender. 2 is tender. All of this is tender. All of this is compensating. We're going to work on S3. Now I need to check up top.
I'm tired.
Lean back, please. Lean back. Lay back. The thing, Bobby, here with your daughter is this. She's off her meds right now, so she's tired. Okay.
Yeah.
And I don't tell anyone to start or stop meds. Okay. What I got to do is get the pressure off the nerve. That's number one.
Okay.
And she's already moving around as long as she gets movement. Okay. So I'm okay with that. You feel that?
Yes.
Not so bad on the right. This is a left sacrum in S3. We gotta get the boot out of her. There you go.
Towards you.
Yes, ma'am. Put your ear in the hole.
Yeah, I usually get a massage before I get adjustment because my muscles are just super tight.
I get it. We don't do that.
Okay.
You don't need that. Slide up.
Oh, that hurt.
Left hand up. Here.
Oh.
And just bear with me for a second. Really nice and quick. Put your head right there. Can you turn your butt towards me? Bend this knee a little bit. This is okay.
Yeah. Okay.
Head down, please.
Head down.
Look down. Straighten out your body. It's not that you're tight, you're swollen. Come over here, please, back on the chair.
Hold on, I'm a little dizzy.
Yes, ma'am. Take your time.
Ooh.
Take your time. Hold my hand, please.
Okay.
Step away. Have a seat.
Whoa. Hold on. Okay, getting my bearings.
Over.
All right.
Give me the
Ooh. Okay.
Give me the go ahead when you're ready.
Ooh. All right. Think I'm good.
Hands on your lap. I need you to breathe and receive the best you can, okay? Left ear down. Good. Gotcha. Hold on. Breathe.
Thanks. That always feels good.
Let's go face down over here, please. Back over here.
Again.
Yeah, we're doing the tailbone now. Slide up. It's not about pain. It's about just getting through that joint the best we can. Nice and easy. Good. And I need to torque it up to get that right hip up, okay? You with me? Breathe in. Out. Breathe in and receive. That's it. Gotcha. That's it. Gotcha.
Ooh, whoa.
Yes.
Ooh, I felt that.
So you're ready?
Hold on.
Yeah,
I'm shaking a bit. Ooh.
Hi.
I just need to take a. I'm gonna take my time here, so
Take
if you
your
don't mind.
And what we're gonna do is go straight to the side when you're ready. Take your time. Hold my hand.
Yeah.
Look at me.
Good work.
March in place. March in place.
Good work.
Let's go left side down. When you're ready. When you're ready.
Still trying to get my bearings here.
Okay.
Still a little dizzy.
Hold my hand.
I'll be fine. I think it'll just take me a while.
Have a seat then. Let's see if let's scope you and see where you're at.
Ooh. So I feel relief.
swelling came down. First and foremost, the neck is now clear. So that cord pressure you had going on is clear.
Still shaking a bit from the change.
Yes, ma'am. That's pretty wild. That's clear, dude. Crazy. And it wasn't a big crack in the bottom, was it?
I felt it.
But I'm saying it didn't crack like.
I did, yeah.
Come back slowly.
It felt like it did though.
It moved. No, it moved. Check it out. Look, this is your 5.
My body's still adjusting right now. I can feel it. It's adjusting to the change.
Do you see 5? Feel 5?
Yeah, it's better.
Feel S1. S2.
Still getting used to the change there.
Same or different?
It's different.
Walk it out a little bit when you're ready.
I think I might need water because I'm still a little
Please.
dizzy.
Let me get you some water.
It's better.
And done?
Appreciate it, sir.
That's no joke, lady.
It's good work.
I don't remember you falling down when you were 10. That must be.
Something happened around there. I'm telling
Maybe
you.
if we fell, you didn't tell me, or you did tell me.
You guys will figure that out.
Yeah.
Okay?
Yeah.
She'll figure it out.
Yeah.
Thank you.
Half the time when we fall in, when 8 to 10, we don't tell our parents.
Yeah.
And we suck it up depending on what the situation was.
Yeah.
And you've seen some of my stories of kids doing that.
Yeah.
Well, I've got a couple falls since then. I fell really hard snowboarding.
I'm talking about the initial injury if you want to know.
Yeah.
And the reason I bring it up is this is not something that happened in the last 5 or 10 years.
Okay.
This is an old injury, okay? And it just progressed with all her other stuff and the fact that she's active.
It's good change.
Good?
It's good change. I'm still adjusting to it. My body. It's good work.
Never see over here. Let's retest. Neck is clear. Sacrum is clear. That's where we're going to start. Look, lean back, lean back. That's your L5.
Okay.
Cough.
Oh, it doesn't hurt as much.
Cough.
Still a little tender there.
Less though?
Less, way less.
Now you're going to get the buff and polish. We're going to break up scar tissue with the machine. Alright, if anything is too much, you let me know. 3, 2, walk it out now. That should be a little bit easier now.
Yeah, because massages really help me with the pain. But that felt good right there.
Let's check the hands. Squeeze my hand. Squeeze. Squeeze. Come this way. Squeeze my hand. A little bit in the elbow.
Oh. Woo!
Rest.
Yes.
Squeeze. Squeeze. Relax.
Oh.
Gotcha. Turn that way. I gotta do your ears.
Woo! I've never done. Woo! Whoa! That's different. I've never had that before. It's different. That felt different.
Okay.
Yes.
All right.
Interesting.
That's where we're gonna start.
My body's still shaking from all the change. It's trying to get used to all the change. Good work. A lot of good work.
Here's what I want to do.
My hand. It's shaking.
Right,
Good shaking.
hold my hand. On top.
Been through a lot.
Yes. You're here for how long?
As long as it takes me to get better.
Okay. We need to get your swelling down. We need to get the sacrum sorted. I need to get to that L5, L4. But we're not there right now. Okay?
Okay. Ooh!
There was a little bit more.
Oh!
Squeeze.
A lot of good work.
Squeeze.
A lot of good work.
Squeeze.
I'm scared now.
Squeeze.
I'm scared.
Squeeze. You're all set. Questions for me?
Yeah, really appreciate it. And I know that's what you do for a living, and I'm just super grateful for my parents. I definitely don't want to go to surgery if I could help it.
Well, let's do this. I'll see you probably for a total of 2 weeks if you can be here for 2 weeks.
Great.
Could be
But
even longer.
I'm just saying, but I will have an idea.
Yeah.
We'll see the changes in those 2 weeks.
Mhm. Okay.
If I'm not getting any result in that time, then we have to reevaluate.
Okay.
Okay? Because it shouldn't even take that long.
Okay.
I'm not saying to fix everything, to get you balanced so that you can start functioning again properly.
Mhm.
Okay?
Right.
Madam?
Thank you.
Welcome to the office.
Appreciate it.
You're welcome.
Appreciate it.